News headline: Experts call for clear food labeling to curb excess salt intake, save 1.6 million lives. Health experts are raising the alarm over Nigeria's growing health crisis linked to excessive salt consumption, which contributes to deadly non-communicable diseases, NCDs, now responsible for 29% of all deaths. At a high-level roundtable hosted by the Network for Health Equity and Development, NCDs, and its partners in Abuja, experts called for urgent policy reforms and mandatory front-of-pack labeling on food products to empower consumers with clear health information. Speaking at the event, global health advocate Ekior Joseph revealed that the risk of premature death from hypertension, closely tied to salt and fat intake, has surged dramatically, with prevalence jumping from 8.6% in 1995 to 32.5% in 2020.
What is this new thing that is coming? What is the importance to you?
The roundtable themed empowering media to advance sodium reduction and front-of-pack labeling for a healthier Nigeria highlighted the dire situation, especially for adults and children, who are increasingly exposed to unhealthy diets that fuel obesity, type 2 diabetes, and even cancer. While speaking, Joseph warned that without decisive action, more Nigerians will continue to die needlessly from preventable conditions. He emphasized that informed dietary choices begin with clear, easy-to-understand food labels and aggressive public education campaigns to mitigate impacts.
Daily consumption of salt should be less than 5 grams. But how many people can assess that? When you look at how much of food you take in a day, how do you know what 5 grams is? The bottom line is that it's best to have a minimalistic approach. So take as little as possible. Another way to look at it is take less of what you were taking before. We're not saying abstain totally from salt. Salt is an important component of the body and it drives fundamental processes in the body. So it's about, the message is reduction and not abstinence.
Supporting this view, food safety consultants John Tessin and Kapas Abayo Isurumi stressed the need to put public health ahead of profit in the food industry. They charge the media with compelling storytelling and evidence-based reporting to push for accountability and spark behavioral change.
There are 34 food categories, okay, that we understand that Nigerians are eating a lot. One of them is bread. The other one is bouillon cubes. The other one is meat and meat products. Many of us will take bacon. Many of us will take so many of these salty foods. So the Nigeria has now come up and said, okay, we are not asking you not to take them, but be conscious. And we are working with the industry that they have to reformulate their food to ensure that what they produce to the market conform with these guidelines. And NAFDAC is coming and turning those guidelines into a law, so that if you build or if you make something or you manufacture something for public consumption and it's outside these marks, then you'll be liable.
To a Nigerian, they will tell you that excess salt is bad, but sometimes they don't connect it beyond sweaty palms and the possibility of hypertension. They do not understand how dangerous it is to their health in general, especially around non-communicable disease. And because the public trusts the media, it is essential to have you in the room, understand what the issues are. Because again, there are a lot of myths around the issues of consumption of salt, religious issues, traditional issues that have turned into norms.
With the right awareness and policy shifts, Nigeria could reduce salt intake by 30%, potentially saving 1.6 million lives yearly. As these experts believe, the fight for healthier food starts with informed consumers and ends with a nation free from the silent epidemic of salt-related diseases. Vincent Okushi, QTV News.